All right, I apologize for that. Welcome once again. Now I have to start the intro all over. Welcome once again to your Saturday online clinic. All right, my name is Regina Askia Williams, and I'm reaching you from New York City. And today we're going to be talking about medication safety, like I said earlier. Medication safety. We studied the population in Nigeria, and we also studied most of the medications they take, and we came up to. Somebody has to mute their mic. Somebody has to mute their mic. Somebody has to mute their mic. Thank you. All right. So our listeners, some of them don't know they have to mute their mics. Thank you. All right. So we studied the population in Nigeria, and then we came up with this group of medications that are mostly purchased and used by Nigerians. Can I have my paper, please? Thank you. And that group fell into painkillers, malaria medications, blood pressure medications, antibiotics, birth control, steroids, and respiratory medications, okay? The problem with this is people don't get diagnosed properly. They go to the chemist and they buy whatever the chemists say they need to use for an ailment. It is important to be properly diagnosed by a doctor and then have a plan of care, then pick up your medications as prescribed by a doctor and follow a proper plan of medication use, failing which you might expose yourself to some adverse reactions, okay, from improper medication use. So today we have Dr. Felix Egbase. Dr. Felix is a renowned pharmacist, and he studied in Nigeria, but he continued his studies out here in the United States. He is based in California, and he has graciously joined us this morning, only by phone, and will be talking with us about these medications and their side effects. Dr. Felix, we are very honored to have you on the program. Can you hear us?
Thank you so much, Regina. Yes, I can hear you. Can you hear me?
Yes, we can hear you now. Could we put
Okay, great.
Thank you. Can we put the mic closer to the, yes. All right. So Dr. Felix, can you tell us a little bit about your background so we understand the process of how you came to become a pharmacist and how you came to practice in America?
Well, thank you so much, Regina. And by the way, I just want to appreciate you for all that you're doing.
Thank you.
You know, coming from your show business background and eventually moving into healthcare. Thank you so much. A voice like yours is one that makes a very huge impact, and I am very glad and honored to be here. To go directly to your question, I was born in Nigeria. I was raised in a small town called Urobi in Edo State of Nigeria, and I grew up in a medical household, if you would want to accept that. My stepmother actually had a maternity inside our compound. So I have kind of just been in the medical environment ever since birth. And growing up, I just always wanted to be in a position where I'll be able to make a meaningful impact in whichever way possible in healthcare. And eventually chose pharmacy. You know, in Nigeria, you write your JAM, and then you get admission, and you know what you get admitted into is pretty much what you follow through with. And, you know, I got admitted into pharmacy in University of Benin, and, you know, I ran straight with it. I graduated in December of 2000 and was a pharmacy intern in the University of Benin Teaching Hospital. Was there for the whole year, went to Anambra State to have my youth service, and eventually left Nigeria briefly to the Middle East.
To the Middle East?
Yes. I did a little bit of medical insurance. It was still something related to the medical field while I was trying to get licensed in the Middle East, as it were. And then eventually I got licensed in Dubai, but never got to practice there. And then moved to the United States in 2004. And then, of course, being a foreign graduate in America meant that
you have to start again.
All of that again.
Yes.
Yeah. Did you say something? I'm sorry, I missed
yes, that. Being a graduate here, you have to, like a foreign graduate, like you said, you have to take so many exams and jump so many hoops to prove that you really understand your craft, right?
Oh, absolutely. And that's the beauty, because initially when you come in, especially when you come in from Nigeria, the idea, just because the practice here is so structured and it goes pari passu with with a lot of legality.
Yes.
I mean, there's a lot of things you could do in Nigeria and just not think about, give it a second thought. But over here, you have to be in tune with the law. Your practice has to be in tune with the law. And
Can I jump in there for a minute? What types of things can you do in Nigeria that you cannot do here when it comes to medication prescription?
Oh, I mean, for any of us, I mean, who lived and grew up in Nigeria, is the fact that you walk into a pharmacy, for example, and the pharmacist is not there. Sometimes they are not always there, and then you have to deal with ancillary stuff. You are talking to salespeople, you are talking to pharmacy technicians, and they have to do their job, obviously, but the actual fact is you need your professional to be there 24/7. If it's called a pharmacy, it should have a pharmacist on duty every time that it's open. Now, on paper, that's what is supposed to be in Nigeria. Every once in a while, unfortunately, that's not what happens. Even as a pharmacist, I've gone into some pharmacies in Nigeria and there was no pharmacist available. Now, when you go into a pharmacy and there's no pharmacist available, there's already a disconnect. Definitely.
Okay.
And and then to go further with your question, of course, in America, like even so much so as different states have different laws, for different things in America. So all of that is like a little bit of culture shock when you come in as a foreign graduate. But you already have the basic training. All you just have to do is make yourself in tune with your new environment and just roll with it.
Okay. All right. So everybody's waiting to hear from us. I hope our viewers can hear us. Doctor, in our prior discussion, we had talked about the classes of medications we're going to talk about, because a lot of Nigerians just walk into the chemist and probably don't speak with the pharmacist and just buy what the chemists say they might benefit from. So let us talk about this group, classes of medications, and talk about why they should be taken with care. How we do that, we'll be talking about what they do to the body, how they work, and the side effects that we should watch out for. Let's start with the biggest group of medications that Nigerians especially buy. Painkillers. Let's talk about painkillers and how they affect you. I would appreciate if you talk about the effects of painkillers on the stomach, the gastric system, and on the blood, like thinning the blood and all that. Let's listen to the pharmacist for a minute. Let's talk about painkillers. Thank you.
Okay, great, Regina. Thank you so much. Painkillers are a very broad term. I mean, there's different classes of painkillers. But in order to start on a good foundation, let's start from the basics. Why do you need to kill pain? Pain is usually a symptom of another disease. Mm-hmm. Okay? You could have headache and then result in pain. You break your leg and there's pain after that. Mm-hmm. So pain is a symptom of another underlying disease. And the mechanism of a lot of the medications that treat pain is to try to block, number one, try to block the nerve receptors. Mm-hmm. Because when you have that continuous firing of the nerves, then the pain intensifies. Another part of the pain management issue, it could be if the pain is resultant due to an inflammation. Thinking about an inflammation as an alarm system.
Yeah.
If you have an alarm in the home and somebody breaks in and the alarm triggers, okay?
Yes.
The alarm is not triggering by itself. It's triggering because somebody broke in the home.
Yes.
Pretty much that's what pain is like. It could be due to inflammation, it could be to an injury, and it could be maybe also just to an organ dysfunction. Now, because of the different reasons for pain or the different foundations of pain, different medications act in different ways. Now, the most widely prescribed medications for pain are the medications you would call the non-steroidal anti-inflammatory drugs.
Yes.
You probably hear people say NSAIDs.
Yes.
But this medication is pretty much, your first culprit there is aspirin. Another one, very popular one, is ibuprofen. Feldin. Feldin used to be very popular when I practiced in Nigeria. I'm not sure if it still is, but if it still is, yeah, Feldin is an anti-inflammatory drug. The other name, the chemical name is pyroxicam, and then you from the dolo beads and the naproxen, all of those are, you would group as anti-inflammatory drugs. But let's work with ibuprofen a little bit. It's one of the most common anti-inflammatory drugs that's prescribed, ibuprofen and aspirin.
Yes.
Now, it's very common use for people just up until maybe about 2-3 months ago. The recommendation was that, especially for black people, once you go beyond 50, you should start daily aspirin regimen. Now, that information has been fine-tuned a little bit where it says now that except you are predominantly with the risk factor for heart disease, then there's really no need for people who are 70 years and under to start an aspirin regimen. But the reason aspirin comes right into it because, number one, it's over the counter. When you grab a medication over the counter and then you go get another prescription for pain, that prescription you're getting for pain, let's assume ibuprofen or Feldin or naproxen, if you are going to take it with aspirin, you're already putting yourself in a lot of risk because aspirin, being an acid, the chemical name for aspirin is acetylsalicylic acid. It is actually an acid. And what we do is when it goes into the stomach, it can gradually wipe off and erode your stomach linings.
Okay.
That can lead to an ulcer. That can lead to a whole lot of other things. Now, guess what? When you add another non-steroidal anti-inflammatory drug, you're actually increasing that chance. And I used to have classmates who would do these, and then 2 days later, 2 weeks later, 3 months later, they're complaining of stomach ulcer.
Yes.
So now you're treating your pain, and then all of a sudden, boom, you just got yourself into another medical situation.
Yes. So
another group. I could go on, but this was just a little short. The other group of medications, the other widely prescribed medications for pain, would be the ones we would call the narcotics, the opioids. Fortunately, for now, in Nigeria, except for tramadol, we have really not had a big epidemic with illicit opioid use. That is good news.
But that is on the increase. That is on the rise, though.
Oh, yes, absolutely. I know it is on the rise, and that's what I'm saying. For now, where we are is good, but it is coming, and we all know it's coming because, first of all, I think the reason it wasn't there pretty much was because of affordability, and now as economic status increases and purchasing power increases in Nigeria, of course, those things are going to find their way into the Nigerian market. Mm-hmm. And please, if you are ever going to take an opioid medication, the very first thing it's going to do to you is knock you out. It's going to make you drowsy. That's a big issue with them across the board with all opioids. And for anybody that's even taken tramadol here, guess what? Tramadol is not even as strong, okay? Up until last year, it wasn't even considered an opioid like that. But because we have an epidemic now in Nigeria, with all the news we have to deal with tramadol, now it's become a victim, and everybody's focusing on it.
We have a big problem. We have a big problem when opioid medications are taken with things like alcohol and some other medications that potentiate their effects. And we have had instances where mostly the deaths we have heard of are those of celebrities passing because they mix their opioid medications with something else, and that caused them to be unable to breathe. They went into respiratory distress and passed on. Can we talk a little bit on why you must not, or the dangers of mixing your opioid medications if they are prescribed? The dangers of mixing your opioid medications with some other medications that may cause you to have that kind of reaction.
In fact, the biggest of all of them would be when you mix them with a group of medication called benzodiazepines. Benzodiazepine, excuse the big words, I'm just talking about Valium. I'm talking about all of the medications on that line. And because most of the time, in most cases of opioid overdose, they are in addition with the benzodiazepines. And it's usually a cocktail Why? Because these benzodiazepines relax your muscles. Okay, once those muscles are relaxed, you feel good, and then you add the opioids, which are also have a huge potential to cause a depressing effect on the lungs. And what now happens is you have a cocktail of two things working together to depress the lungs, and that's why there's usually respiratory arrest in this kind of situation. And then because of that respiratory depression, which now means that this person cannot breathe. But what's funny is that they are sleeping, and because of the effect of the opioid on the brain, which already gives them a feel-good feeling, it just relaxes them, and they don't even know they're passing out. And that's how dangerous it is. Now, the other big thing, especially for the Nigerian environment, you just look at the alcohol use. I mean, it's rampant, and that's I'm just being very careful with that word. It's a lot more than that, but it's so rampant. There are no checks. You literally can get any amount of medication. I've seen somebody in Nigeria stagger. Dance like a drunk person and still get more alcohol. You cannot do that. And then when you are with these medications that are depressants as well, and you add alcohol to that, guess what? You just tripled, what I already talked about. And the usual mix for people who are in this category of misuse is alcohol, benzodiazepines, and the opioids. That is a no-no. In fact, just having opioids by itself, we've had cases where somebody's addiction started from their very first use of opioids. That's how bad it is. So it's really something to be very careful about. But the bottom line of everything is, if you take your pharmacist along, let your pharmacist know every medication you're taking.
Yes.
And that goes with whatever medication you are on as an individual. Always have a list. Update that list.
Yes.
If you stop taking one, you can cross it out and say, I stopped taking it on so-and-so date. But, still leave it on the list. When you see your pharmacist, hand it to him. Let him have a quick look through of it. And then they'll be able to tell you which is going to work well and which is going to work, optimally. Every once in a while, it might just even be that you take one in the morning and you take the other one in the evening, and then you have the best therapy going forward.
Okay. All right. Thank you so very much, Doctor. My cameraman, please let me know if anybody has any questions, okay, or anybody wants to make a comment. Now, the next group of medications that I'd like us to talk about is malaria. When people get sick, they like I said, go to the chemist. Usually, I don't know what type of thing they do, but everybody seems to have typhoid. And everybody gets treated for typhoid. Well, whatever happens, everybody gets treated for typhoid. This is what I have heard from most of the people I have spoken to. Now, let us talk about typhoid. Why there needs to be a blood test to determine that it is actually typhoid and it is malaria or it is something else. We cannot treat everything for typhoid, or we cannot treat everything for malaria. Can we talk about those group of medications that are often prescribed for typhoid and also for malaria? Because the chemist tends to just treat all these together. If one works, it works. If it fails, it fails. He just throws the drugs out there. It will catch something, hopefully. And that is not how, it should be. Can we speak a little bit on malaria as well as typhoid?
Sure. Thank you so much, Regina. The thing with malaria, typhoid, and, I would like to add dysentery and, diarrhea and all of those things.
Yes.
Group all of them is what we, consider all of them infection.
Yes.
And we group all of those as infectious diseases. Now, the beauty nowadays is that we have every tool, from diagnosis to treatment, there's every tool available. It's not even like what it was before, where, we didn't have the internet. Literally everybody in Nigeria now carries internet, everywhere they go. I'm talking your phone. So the medical professionals, doctors, pharmacists, nurses, technicians, everybody now is equipped with all the information that they need, to give the best treatment for issues like this. Bottom line is this: if it's an infection, there has to be a test to confirm what infection it
has to be a test.
And there
Yes.
also needs to be a differential. That's a little technical, but what I'm saying is, if it's malaria, what kind of malaria parasite are we dealing with?
Exactly.
Because, there could also be different kinds. And the same goes with typhoid. Now, to give, our doctors, which I think, in my opinion, they do a great job, especially in the African environment. I mean, you have professionals who, a lot of them do not have the tools of the trade.
Yes.
Whether by, funding constraints, financial issues, and just a general situation that just happens to be that. But I still respect the amount of energy, the amount of enthusiasm, that they put in. I mean, I speak to doctors in Nigeria that see, upwards of 50, 60 patients a day. That is a lot, and these are human beings. And guess what? Who's going to take care of the caregiver? Who cares for the caregiver? But anyway, to go directly to the point, there are certain situations when it comes to infectious diseases where you say a particular disease is endemic, meaning that this disease is very common in this area. And then somebody shows up with the classic symptoms. Okay, malaria, for example. I've had malaria. I used to have it a lot when I was in Nigeria. And you have the headache, and then the feverish condition, the shiver. I mean, you could even self-diagnose. But that being said, let's also not forget. Remember all of those commercials we used to see on TV where they say, if your symptoms persist after 2 days, consult your doctor. Okay? Now, that is still very true today. If there is a diagnosis, if the doctor wants to treat you, there's something we call empiric treatment. What that pretty much means is that, okay, we are covering all angles. Now that you are here, you are shivering, your eyes are swollen, you can't move, you are weak. Let's just, treat everything that we think you have right now until we are able to get the results of your test. Now, when those results come back, those are definitive, okay? Because now they tell us exactly what you have. And in going forward with that, the drug therapy after the test results should be definite and directly tested. But the good thing about infectious diseases, malaria, typhoid, and all of that, is that you are going to work with antibiotics. We are going to give you pain medications because of all that inflammation you've had due to the infection. Then there's also going to be, some vitality medications. I'm talking vitamin B, or, we just want to give you vitamins because when the body is going through that whole process, it's losing some of its vital nutrients. And let's not also forget that most times when you have these diseases or these infections, your appetite goes down. You can't eat. And when you are not eating, you are losing some necessary vitamins. So the vitamins need to come into that regimen. Well, now let's talk about the antibiotics that are going to come with it. The doctor is going to prescribe a set of antibiotics. And guess what? When a doctor prescribes you antibiotics, they are usually, supposed to tell you for how long it's going to be for.
Yes.
The doctor will tell you, take these twice a day for 10 days. Please, 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 and please again. When you have an antibiotic that the doctor says take for 10 days, take it exactly for 10 days.
Why?
Sometimes.
Why? Can we speak on why?
You have the thing with bacteria and the viruses and all the organisms that cause infection is that they are in a battle with your medication. Okay, and for everybody who knows, the art of war, if you get hit, you hit back. If you get hit, you hit back. But while you are hitting back, you're also devising a way to make sure that the next time you get hit, you don't get hit too bad. What that simply means is that these infectious agents are finding a way for your medication not to work.
Exactly.
Okay, they are, especially for viruses, they can mutate, they can change their structure, they can change their form.
Yes.
For the medication, and then all of a sudden, medication is not able to attack them because the way the medications are designed sometimes is to act on the surface, change the surface structure, and all of a sudden, that organism dies. But guess what? The organism is literally, trying to wear a bulletproof. Now, guess what? If you take that medication for 2 days and you stop it, the antibiotic, in this case,
the bacteria,
the organism is going to be like, oh, yeah, it's good on here. Guess what? That space you gave them, they are going to they mass produce, the new set of ones that have come may just be the ones that are resistant to that medication.
Yes,
and guess
they
what?
develop resistance to the medication.
Dangerous thing about antibiotics, about microorganisms building resistance to medication is that because you did not take it, it's not just you alone. When you have those resistant strains, okay, because of irresponsible antibiotic use, guess what? If that strain infects someone else,
will not be able to contain it.
We now have a health epidemic because the medication that we have, we now have an organism that is no longer susceptible to that medication. And I'll give you a very good example. Why don't we use chloroquine to spray malaria like we used to before?
What happened? Tell us.
Excuse me, say that again, Regina?
Tell us.
Okay, yeah, because, you know, it was, number one, it was indiscriminate. Number two, there was a lot of people who were not, you know, finishing their doses or finishing the course of their doses, or, you know, there's also something we call subtherapeutic doses where you don't give enough. You know, the dose or the prescription is not enough for the disease itself. And then all of a sudden you have an epidemic. Do you know how much for anybody who ever bought chloroquine? I mean, you could have malaria and your whole course of therapy for chloroquine will be 10 naira. Okay. Now we are going with Lonax and all of these other medications in the Nigerian market. Just compare in your mind the price of Lonax now and the price of what chloroquine used to be. Guess what? We are spending so much more to treat the same disease. Why? Because we had, you know, we left room for resistance. And this goes for typhoid. This goes for, you know, anything that's an infection. So basically the thing with antibiotics is when you are giving antibiotics, make sure you finish the whole course. Okay? If you forget to take one, take the next dose immediately you remember. And in certain medications, you know, and this is why you always need to be in tune with your pharmacist. There are certain medications where all we want you to do is to have the full, you know, the full dose. It could be in 5 days, it could be in 7 days. But if you forget one, it doesn't mean, oh, I forgot to take it yesterday, I'm just going to stop it. No. If you are taking it morning and evening, and you forgot to take the morning one, maybe you remembered in the afternoon, go ahead and still take that afternoon dose. In the evening, if it's a medication you're taking twice a day, which means then the duration of action is probably 12 hours. In the evening, you can still go ahead and take the next one. But if it's already within 2 hours or within 4 hours, 2 to 4 hours of the next dose, then you can skip the next dose. But go back to your regimen as soon as possible.
Great. Okay. Thank you so much. We talked about bacteria getting resistant, or infective agents getting resistant when we do not follow responsibly follow the regimen for antibiotics. We talked about side effects of pain medications and opioid pain medications used in conjunction with agents that potentiate their effect. We talked about gastro bleeding and ulcers that may result from indiscriminate use of pain meds. We talked about making sure you see your doctor, speak to a pharmacist before you purchase anything from the chemist. Okay, we would like to now talk about respiratory issues, asthma, and cough and cold and all that in Nigeria. This is another class of medications that really get abused. People buy cough syrup for anything that has to do with running nose and inability to breathe. It's such a shame that we still hear about people dying from asthma in today's world, where in advanced societies, kids are taught an asthma regimen, what to do when your attack comes on, medications to use as rescue meds, medications to use as long-term medications. We need to have that type of education going in Nigeria. It is really sad to hear that somebody passed from asthma. Let's talk about respiratory issues, from the common cold and cough to asthma to tuberculosis to TB, which is now on the rise, especially with the advent of HIV and AIDS. Please, Doctor, throw more light on that for us.
So, Yeah, thank you, Regina. This is, yesterday I got information that broke my heart, and it's unbelievable. I mean, let's look at a few numbers here I'm going to throw out. In 2007, just 12 years ago, malaria was the biggest cause of death, okay, the biggest disease that was causing death in Nigeria. Fast forward that 10 years after to 2007, malaria is number 4. Okay? Malaria has not become, and what's hidden in these statistics is that malaria did not become number 4 because we started treating it better and the outcomes became less. No. The other diseases became more. And when you tell me that lower respiratory infection is the biggest killer in Nigeria, that is just heartbreaking. Yeah. And I'm going to break it down. And these data I just threw out is from the Global Bureau for Diseases, and that is one of the companies owned by Bill Gates in this charity work for healthcare worldwide. And it's also being quoted by the Center for Disease Control,
yes.
Which is the foremost disease monitoring agency here in America. And, they have their tentacles pretty much all over the world, and their data is very, very reliable. Now, the second one became neonatal disorders. That's just unbelievable. But when you tell me that HIV/AIDS is killing more people in Nigeria than malaria, so literally we've gone from lower respiratory tract infection, neonatal disorders, HIV/AIDS that just all sprung up to be ahead of malaria. And then you have the diarrhea. These are malaria, diarrhea, and meningitis have always been endemic, especially for the tropics.
Can I ask you? Can I take you back for a minute because I did not really get that. You said your data you have says that malaria is now number 4. What are the first 3? What are the first 3?
Oh, the first 3 lower respiratory tract infections, and I'll break that down later. The second one, neonatal disorders. I mean, things surrounding childbirth, premature births, and all of that stuff. And then you have HIV/AIDS.
Okay.
Okay?
Yeah, okay.
When I left Nigeria in 2001, the prevalence of HIV was about, a little over 9%. And that was, 19 years ago. And look at where we are. But anyway, that's for public health discussion. So let's talk about respiratory tract infection.
Yes.
Now, the specific one that's dealing with Nigerians, seriously, is the lower respiratory tract infection. I'm talking pneumonia. I'm talking bronchitis. Okay? These are infections that have to do with your lungs. And please, for anyone listening to me, wherever this goes, if you have a cough is no longer, I'm just coughing, give me a handkerchief. Please, no. If you have a cough, seek medical care right away. You have no idea what a single cough. I mean, cough is a symptom of a whole lot of things. Make sure that no matter what, the reason for your cough is diagnosed. If you have to see 2 doctors just to seek different opinions and be able to make an informed decision, please go ahead and do that. I mean, cough could be a sign of cancer. Cough could be just an infection, yes. Cough could be due to irritation. But please, if you have a cough, especially the one that makes you very uncomfortable, the one that makes you lose your breath, the one that, produces sputum.
Yes.
Don't just grab that handkerchief and expect it to go away. Please seek help. Now, the major ones for that respiratory tract infection, like I said, bronchitis, which is an infection of the bronchioles, let's use the layman's term, windpipe. The lower end of the windpipe that connects to the lungs. Those are the bronchia, and that is where an infection of that area, is considered a lower respiratory tract infection. Another big one is pneumonia. And these are infections. What this simply means is, as soon as the diagnosis is made, then definitely because nowadays we have all the resources we need. I mean, you could even just personally, okay, as a patient, go to Google and say, how do I treat bronchitis? You will see every information on there. But guess what? What you really need is to go to your doctor first of all, to make sure that you know what you have.
Yes.
Okay? Because your older brother was coughing and he took amoxicillin doesn't mean that you are going to take amoxicillin for your cough too. No, never. Guess what? Even for identical twins, you could have appointment with your doctor. If you don't have a doctor friend, go and find one. If you don't have a friend who is a healthcare professional, go and find one. The reason I say that is because the healthcare system, the healthcare industry is so convoluted sometimes. It's overwhelming, especially when you are looking at it from the outside. Like, for example, if you have a cough, you're just like, oh my God, what do I do now? And usually, guess what? These things always happen in the evenings.
Okay.
It's not because they happen in the evening. In the evening is the time you are trying to rest, trying to watch TV and just relax. And that is when the body is now telling you, hey, this thing has been wrong all day, but you didn't notice it. Now you're going to notice it and it's going to affect your sleep.
Oh.
So if you can send a text message or, a chat or WhatsApp to anybody, they can be anywhere in the world. Just tell them, hey, see what I have. They could at least tell you, okay, reach out to this guy or reach out to this guy.
Okay, let me send a text message to you now and ask you if I have a cough and I go to buy cough syrup or cough medication. Okay, I have not been diagnosed yet, but I need something to take care of the cough. There is expectorant, there is suppressant. What do you advise a person to do? I know the patient has to go see the doctor and get this cough diagnosed because it just might be more than, ordinary cough. Like, say, if after 2 days your symptoms don't improve, go to the doctor. But if you go to get cough syrup, should you get expectorant or a suppressant?
Depends on the kind of cough that you have. If you have a cough where you produce sputum, okay? Anytime you cough, there's spit and there's mucus and there's phlegm in your throat.
Yeah.
Okay? You definitely need an expectorant. Now, what does that expectorant do? Let me tell you, expectorants don't treat the underlying effect of cough.
Yes.
They're only treating the symptoms. All that expectorant is doing is pulling out all that mucus, okay, from your lungs or from your windpipe. But the reason for your cough, the direct infection that you have, if it's an infection, by the way, is still there. Now, if you are coughing and it's just a dry cough, what we call dry cough is a cough that doesn't produce sputum. Mm-hmm. Okay, that's a dry cough. Mm-hmm. And I grew up in, I grew up in Uromi. It's a rural community. A lot of untarred roads, a lot of dust. Mm-hmm. Now, if a car drives past you and they blow all these dust into you, it goes into your nose, it goes into your mouth, you are going to cough. It's the natural reflex. Okay? Mm-hmm. You're going to cough. But that is not the kind of cough that makes you weak. It's not the kind of cough that when you are coughing, you feel dizzy. It's not, so these are just, you're just coughing because of all the dust that just went into your system. Now, that's easy to deal with. If it's not producing sputum, you could get a cough suppressant. Okay? You get a suppressant, and all that it does is it numbs the reflexes, okay, the part of your brain that is firing your windpipe. Okay?
Yeah.
So cough, it just goes there, numbs it, and then it says, hey, don't send that message anymore. And,
okay.
So that kind of suppresses the cough.
Okay,
but
so now...
Remember, let's bring us back to, remember the commercial, what we call advert in Nigeria, for Benylin those days, where they say, if symptoms persist after 2 days, consult your doctor. There's a reason for that.
Okay.
Of course, as a pharmacist and as a medicine person, we are the most accessible healthcare professionals. You don't need an appointment to see a pharmacist. You don't need, in fact, you don't even need this permission. You literally walk into the store and just say, the pharmacist around, the pharmacist shows up and you ask your question.
Okay, let me ask another question.
In that unique position.
We have another question. It is crucial that the airway is clear because when the mucus blocking the airway, there is the exchange of oxygen in the system is impaired. Now, there are other conditions that lead to impairment of oxygen exchange, and this condition, foremost, would be asthma. When the body is reacting to certain allergens or triggers, the airway may close, like it may produce a lot of phlegm or something, and it will close up, or it will feel like it's closing up. And people who experience this are unable to get in adequate amounts of air that will supply adequate amounts of oxygen. Let us talk about asthma for a minute. Asthma, one of the symptoms of asthma is coughing. Another symptom of asthma is just before it gets very serious and the person goes into respiratory distress, get your child. look at the middle of the throat, this area, right? If it's like moving very fast, it means the child is in some mild distress and needs to be seen by a medical expert for maybe a nebulizer treatment or whatever they want to do depending on what they diagnose. But I'd like us to spend a little time talking about asthma, because a lot of people experience asthma, think it's just cough, and ignore it until it's too late. And when it's too late, it's difficult to come back from asthma, because the most important thing to keep a person alive is adequate exchange of oxygen in the system. So anything that is going to block your airway has to be, receive critical consideration. So please, Dr. Egbase, take us through the medications of asthma and basic asthma regimen for people watching. If you have asthma, what are the first 2 things you have to do, or first 3 things you have to do to ensure that you stay alive? Thank you.
Thank you so much, Regina. The beauty about asthma therapy is that usually it is caught on time. That's because there is a genetic component to asthma.
Yeah.
But that being said, it's a huge inflammatory disease, which means the onset is usually when kids are growing up. Okay, and in the, maybe during the course of immunization and all of that medical intervention during, childhood to adolescence, they are usually diagnosed. And then with the baseline diagnosis, we know you have asthma.
Mm-hmm.
Now you have an opportunity to say, okay, what do I need to do? The hallmark of treating asthma is to keep the airways open.
Yes.
Because the inflammation of the airways that keeps shrinking. Okay, let's look at the water pipes. For those people who have water pumps at home, when all the pipes clog, you are going to notice the pump, the sound is going to change because it's not doing more work. Okay, to push out water. It's kind of how the airways are. Okay, when they get when all this inflammation begins to cover those windpipes, then the brain does a whole lot more work because now it's not getting the much oxygen that it needed.
Yes.
Then the lungs continue to do more work because the oxygen exchange and all the what we call perfusion, because all that oxygen, some have to go to your brain and some have to go into your blood. When all of those constriction happens, then of course we have all of the issues, with asthma. But the beauty is that the 2 things we need to do is to open up the airways. That's number 1. Open them up. Mm-hmm. Number 2, don't just open them up, keep them open. Mm-hmm. And that's why the major treatment for asthma, you will hear, they tell you to hold, whether it's an inhaler, okay? It could be a albuterol, it could be, all of the other ones, but there's something we call rescue inhaler. And anybody who's never ever been diagnosed with asthma,
yes,
okay, please have your inhaler handy every time, okay? I would say have one in your pocket and have one in your handbag.
Yes.
And if you're a gentleman, you don't, want to be caught with the stigma of saying you carry a handbag around. Dude, you have a health issue. Grab nowadays we call them man bag.
Yes, man purse.
Whatever you want to call it. Have your rescue inhaler in there.
Okay.
I personally,
Question.
This is because I used to have a medical supply store. I used to sell bracelets, where you just put your underlying medical condition. Now, that could be a little extreme, but if your asthma is severe, I would tell you carry an asthma bracelet, please.
We have a question. We have a question, doctor. Yeah. We have a question.
Sure.
Okay.
Yes.
My wife has. Oh, okay. I really don't know how to pronounce the name. It's ODK.
Yeah.
My wife has had this cough for weeks now. She has gone to the hospital, taken all medications, but it's still there. What do we do?
His wife has a cough for 2 weeks, he said? For he has
weeks.
gone to the hospital?
For a week, right?
No, for weeks.
For weeks.
Oh,
He has gone to the hospital. She has taken medications. It doesn't seem to be working. What does he do? But I mean, if he went to the hospital, it should be a diagnosis, right?
Absolutely.
So we cannot give him what to do from here, because somebody has to look at the results of the test, the diagnosis, and then follow up on what type of medications, depending on what infective organisms were found in the test. So I am at a loss to advise that viewer on what to do. Maybe he went to the chemist, or maybe he went to, maybe somebody just prescribed it, but he needs further tests, and those tests need to be looked at by a doctor. Okay? All right. Okay, Dr. Egbase, continue, please. We were talking about asthma
I just
care.
talked about the inhalers,
Yeah.
The
Please,
inhalers, all about the inhaler.
this was inhalers, mostly albuterol. These are rescue medications for asthma. Now, there are treatments that contain steroids. When a person takes steroids...
And that was just what I was going to go into.
All right,
now,
so I'll let you go into
the
that.
Inhalers, okay, and by the way, albuterol in Nigeria, they call it salbutamol.
Oh, okay.
But it's the same thing, okay?
Okay.
You have a salbutamol inhaler, if you have an albuterol inhaler, they're pretty much the same thing. Now, the second part of that treatment would be to keep the airways open. What I mean is to keep it open long term.
Mm-hmm.
And that's where you need some of the asthma medications that come with, well, we just call them long-acting asthma medications.
Yes.
And there you would have, I don't know if this got in Nigeria now, but very much what these medications do is they have a component that is steroid, and that steroid reduces, just by being a steroid, it reduces inflammation.
Mm-hmm.
Okay, so the underlying cause of the asthma, which is the inflammation, that steroid part of the medication goes to fight that. It reduces all that inflammation so that the closure does not continue. And then it also has another component, which could be a beta agonist. That's just a technical word. Excuse the grammar, but basically what that is a kind of medication we call beta agonist. But what they do is they open up, they work on some receptors to open up the airway.
Yes.
So now you have two things working together to alleviate the asthma. But the beauty of having these is that the more you stick to them, then sometimes you may not have to use your rescue inhaler too much. Mm-hmm. Okay, let's assume for some people, and I have some friends that some very close friends and even family members that might be, I remember during the initial diagnosis they will have to use the inhaler 4 times a day, 6 times a day, and then as they begin to use these long-acting medications, then they no longer need their inhaler for more than once or twice a day. Mm-hmm. Okay, but the bottom line is, if you're on medications for a chronic condition like asthma, first things first, always have your medications. Don't skip them. Don't skip them. Because the thing with oxygen getting to your brain and lungs is that if for any reason you have this attack and you don't get enough oxygen, it could actually cause a seizure. It could lead to a longer term effect, which just because of that, little habit, you're not having to deal with a lifetime of having the brain damage or something.
Or death.
So yeah, always stick to asthma medications as I told you, but always, if you are somebody who's on inhaler, always carry your inhaler along.
Okay, now for steroids, another thing I have to point out, what are the long-term effects of steroids? Like on your bones and on your teeth? What do you do?
Yes, and this comes to the point where you say risk-benefit ratio. That is a term where we say, you are going to have surgery is painful. Now, we understand it's painful, we understand you're probably going to be in the hospital for a whole week, but guess what? After all of that pain, after all of that week, oh my goodness, the appendectomy has been done and you never have to deal with that again for the rest of your life. So all of this is the balance, and that's why we need everybody, to be in good rapport, or always good communication with their healthcare provider.
Yes.
Whether nurse, physician, or pharmacist. There are certain people who will react more with steroids. I mean, steroids, just because of the nature of what they do, they reduce inflammation. They can also reduce the body's ability to fight infection.
Yes.
Because the body has a natural ability to fight infection, and when you are long-term steroid use, okay, that ability can begin to diminish.
So when you are taking steroids, you should be on the lookout for
Oh yeah, there's a blood sugar component to it. For people who are diabetics, for example,
Exactly.
if you're on long-term steroid use, it may begin to affect how your glucose reading begins to happen. But when you continue to see your primary care physician, your doctor, or what in Nigeria what we call the general practitioner, because they are in tune of your medical records, they will begin to see the changes. And the moment there's an alert, they should be able to know that.
Okay.
That thing, there's also something called poor wound healing. What that means is if you have, like normally, especially in a place like Nigeria where, there are lots of people who do farm work and, a lot of manual labor and you get injured, you have a cut or injury, or for somebody who plays sports, for example, maybe normally, you have that scratch, it takes 2 days to heal, 3 days to heal. Now, if you're on long-term steroid use, it might not heal in 2 or 3 days anymore. It might take 4, 5, 6, 7 days. But what that simply means is, if I had a patient, who would come to me and I know they're on long-term steroid use, if they so much as have a scratch, I tell them, hey, put an antibiotic cream on that scratch right
Yes.
away, because your body doesn't have the natural, excuse the language, mojo, to do this fight right now. You need help. That's what it is with the steroids.
Somebody asked, does asthma ever go away? Does it ever get cured?
Unfortunately, no, because I see, like I said earlier, we have that congenital or what's the genetic part to it, and there are groups of susceptibility to it. But the issue is asthma can be forced to a standstill. It can be managed very well where people have very, very wonderful quality of life and they will never act like they're somebody who's asthmatic. So it's just about good management.
Okay, so good management will mean taking your rescue inhaler when you need it, taking a long-term asthma control medications when it has been prescribed, taking care of your body properly when you are on a medication that has a steroid component, when you spraying your mouth, if there's a steroid in that medication, if you're using the inhaler and it goes through your mouth, be sure to wash out your mouth because it has an effect on your teeth. Be sure to take care of yourself and be on the lookout for signs and symptoms that you may not be doing very well. It just means you have to take extra care of yourself if you are on steroids so that you do not mask infections or expose wounds to other subsequent infections if you are on steroids. This has been a very informative session, but I do not want to close out without touching on HIV medication. The HIV scourge in Africa and in Nigeria is on the rise. I'm not very aware that there is enough medications or there's good supply of medications to patients who need this. But I would like to say that HIV is no longer a death sentence. Some of my patients have been managing this condition over 30 years and they are living relatively healthy lives. There are different types of HIV medications for different levels of viral loads according to what your tests turn up. And the focus is to reduce your viral load to undetectable so that the virus does not keep wreaking havoc on your immune system, one, and the chances of infection, cross-infection to people who are exposed to you, is reduced when your virus is non-detectable. It is important to stay on top of your medication regimen when you're HIV positive, very important, despite the side effects. Now, if the side effects are such that you cannot manage, you could see your healthcare provider and they will put you on other medications that may not have such a rough impact on you. I would like the doctor to talk about HIV medications at different stages of the infection and how to manage the most common side effects of your HIV medications before we close out on this afternoon's interaction. Thank you.
Thank you, Regina. And, by the way, thank you so much for bringing about having to rinse your mouth for anybody who's on steroid inhalers. Yeah, that's a very, very important point. I perhaps skip that. Was an oversight, but thank you for bringing that back. Okay, let's talk HIV.
Yes.
Thing is, I like to break it down to the basics so that everybody will understand it.
Yes.
This is what HIV is. Your body has its own version of police, has its own version of the army, and has its own version of the navy. These are what we call the immune system. Okay, your body has this version of all of these security agencies that helps it fight disease. And I'll bring you an example. If you took away the army, you took away the police, and you took away civil defense, vigilante, and everybody, you all know that the country will be in chaos. I mean, I'm specifically talking about Nigeria in this situation. That is exactly what HIV is. The human immunodeficiency virus, which is abbreviated to HIV. This is basically what it does. It goes into the body and it takes away all the defense mechanisms that the body has. And guess what? Once all these defense mechanisms go, the things you could survive before, it used to be that, if you are sitting down and somebody's coughing by you, you will not catch that disease. But for somebody who has HIV/AIDS, guess what? That disease is literally staring in your face because all of that defense mechanism that the body used to have is gone. So now when you have HIV regimen, one of the very big issues with the HIV and the attendant effects is that a lot of the medications will also even make the person feel sick.
Yeah.
They make the person lose appetite. Now, so it's literally double jeopardy we are looking here. But the beauty nowadays is that, like Regina just said, it's no longer a death sentence. I mean, we all know there's some big celebrity people that were diagnosed of HIV, and guess what? I remember one, and 30 years after, they're still there. They've outlived literally almost everybody.
Mm-hmm.
So all I'm saying is, it is manageable, and be in tune with your pharmacist, your doctor. If you are somebody who's fighting this, who has this, which we call them symptoms now because it's literally a manageable chronic condition. That's what it literally is now. The viral loads, keep your appointment. The medications, the side effects, they could be debilitating, but there are ways to manage them. I mean, there are 4 or 5 different combinations, that can be put on, and the way somebody reacts to them will be the, very best way to go. Take them as at when's due, and like I said earlier, with, when we talked about malaria and typhoid, if you forget to take one, take the next dose as soon as you remember. Another big issue with some of these HIV meds too, could be some issues with the bones and the blood. But for somebody who's there, you have to take vitamins. Just because the body doesn't have that vitality anymore, stick to those vitamins. There are certain vitamins, by the way, that can interact with this medication. So always discuss with your pharmacist on the one you choose to go on, and then have your list. Always have your list. I put it on the comments here when I first came in here. Mm-hmm. If we forget everything I've said today, remember, always keep a full list of all the medications that you're taking, including herbal supplements. If you are taking Origin, if you are drinking Origin, add it. You will not believe how many medications Origin interacts with.
What is Origin?
If you are Origin is
that thing in the local thing in Nigeria that they have herbs in gin. They put herbs in a bottle in gin. Is that Origin?
And it's very common in Nigeria.
Okay.
If you are a heavy alcohol user, in fact, if you are, anybody who's managing HIV, go away from alcohol. You will not need it. It is not worth it for you because a lot of these medications get detoxified by the liver, and alcohol gets detoxified by the liver. And guess what? When I was talking about the disease ranking, number 10, the biggest disease that's killing Nigerians. Mm-hmm. Number 10 on that list right now is cirrhosis.
Liver cirrhosis, yes.
Forget liver cirrhosis. Forget the big grammar. That is just
scar tissue
and scarring of the liver. Okay, if you've ever seen somebody that had a fire, you see how the skin is, after the fire, after the burn, you know, it just becomes strong and thick like leather. Okay? That's what we are looking at doing to the liver. And for anybody who's seen liver, I mean, you know how fresh and delicate that thing is.
Yes.
And then for it to turn from that to look like leather, okay, already tells you the amount of damage you are doing to it. So, yeah, please, across the board, reduce your alcohol intake.
Yes.
Whichever way you drink it, you know, reduce the alcohol intake. These are just lifestyle modifications that will make your medications work better.
Yes. Thank you so very much, Dr. Egbase. It was a pleasure having you. The thing with doctors is there's always a patient waiting at the other end. So I know that everybody's waiting to call you for consult. But I'd like to thank you for taking time out to explain these things to us. And I'd like to say to our viewers that this conversation will continue on Facebook. If you have questions still, please let us know in the comment box. And if there's anything we're too shy to ask, please send us a direct message. We will send it to the doctor, and then we'll keep this conversation going. I hope that you have listened to the different medication classes, the side effects, and you know how to properly stay on top of your medication regimen, consult with your doctor, get a good plan of care, utilize a chemist that has a pharmacist on board at all times, and then take your medications responsibly. Dr. Egbase, thank you so very much. Do you have anything to say to our viewers?
Oh, yeah, absolutely. Let me quickly recap on 4 points.
Yes.
Okay, with best medication management and how to deal with your pharmacist.
Yes.
Number 1, medication. Never share your medications.
Never share your medication?
And this is very, very common in Nigeria, where my older brother had cough. He took this medication, worked for him. I have cough today, I'm just going to take the same medication and it's going to work for me. Please, 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 see your doctor independently. Now, if you want to tell them that, by the way, my brother had this, okay, yes, feel free to tell them, because that could also let the doctor know maybe it could be a congenital issue. Sorry for the big word. This could be a family issue or hereditary issue, okay? Yeah. And that just helps the doctor make a better informed decision when they're treating you. Okay. Number 2, always insist on the drug name and dose when anybody hands you a medication. If a nurse, doctor, pharmacist, if you go to see a doctor and he gives you one white tablet and tells you take this one, please, 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 and please again, ask the doctor or pharmacist or whoever handed you that medication, what is the name of this medication? Write it down. If they mention one big name and you can't spell it, tell them to spell it. Okay? Write that medication down. One day, that might just be an information that would make a pharmacist or doctor or nurse or anybody make a very good informed healthcare decision about you. Number 3, always disclose, and I've said this 3 times today and I'll continue saying it, always disclose all medications that you are taking to any healthcare personnel, or if you go to a pharmacy. If you go to a pharmacy and say, man, I feel dizzy, what medication can I take? I just feel lightheaded. Now, the pharmacist, will give you any medication because he's trying to make a sale. But always follow that up with, by the way, I have blood pressure. I'm taking this medication, and I also have diabetes, and I'm taking this medication for diabetes. Okay? What that tells me, guess what? When you were telling me you were lightheaded, I could have just handed you anything over the counter. Maybe I feel you just don't have enough strength, and I'll give you something loaded with glucose to give you strength. But guess what? When you just told me that now, you're also being treated for diabetes, I'm going to take a step back and be like, hold on, wait a minute. Are you sure, now the lightheadedness you are telling me may actually be due to the sum of, another medication that's going to give you more problems.
Yes.
Now, the other thing, and I have to bring this on today because I've heard a lot of buzz online about it, expired medication.
Expired medication, yes.
Expired medication. It breaks my heart that people, I've seen it posted online, somebody went to the pharmacy, they were given a medication, they got home, checked the expiration date, and it had expired a month before, and then they called the pharmacist back, and the pharmacist said, it's been good for another 6 months. That is unprofessional, that is unethical, and that is criminal. Okay? I will confront any pharmacist that tells you that. Only a drug manufacturer can tell you if they have extended expiration for any medication, not just any pharmacist. Okay? And nowadays, for any medication you you have the packet. I mean, it's so easy now to send an email to the manufacturer. Okay? You can send an email to Pfizer. You can send an email to Novartis. Tell them, I have this lot number, and it says this expiration date. Is this correct? Somebody just told me it still has 6 months of good usage. Please, let me tell you, medications are chemicals. What that means is that if they're expired, they just became poisons.
Yes.
Okay? Please, 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 do not ever take expired medication, except on one condition. If the manufacturer of that medication comes to say, yes, this lot and this batch is still good for an extra 3 months beyond expiration, then we can go to bed with that information, because actually they are putting their, their money where their mouth is. So thank you so much, Regina, for
Thank
all that
you
do. Thanks
so
for bringing
very
me on.
much, Doctor. And thank you
I
to...
am hoping, this was just an overview because it's the first time. I'm hoping we can do some targeted diseases down the line.
Yes, we're looking to do diabetes and whatever diseases you could talk with us about.
Oh, absolutely. I mean, how many diseases there. There are over 1,000. So,
yes, we have been talking about targeted diseases, and then we will have another doctor. We have doctors coming different Saturdays to talk about their areas of expertise. Next week, I'm looking to bring in an endocrinologist to focus on diabetes. So all of you who are taking any medication for diabetes and what have you, who would like to know more about hypoglycemia and hypoglycemia and the symptoms to watch out for, please tune in next week. Come with your questions and your comments. For right now, I have to call it a day, and I'll say thank you to the doctor and thank you to our viewers, and I expect to see you next Saturday. For now, it's good night, God bless, and peace out.